Hello, thank you for watching this COVID-19 update. I'm Jenny Collier, the Public Information Officer for Southwest ISD. The pandemic has been somewhat of a roller coaster ride this year. Just when we thought we were going back to pre-COVID times, we saw a surge in cases with the Omicron variant. So we thought we'd take this time to answer some of the many questions y'all have had about our use of masks, about our safety protocols, testing, and quarantines. Joining me now is Superintendent of Schools, Dr. Lloyd Verstuyft, and Director of Health Services, Lynda Guerrero. Thank you all for joining me. First off, Dr. Verstuyft, can you give us an update on where we are as a district in terms of dealing with the pandemic?
So as we started our fall semester that we just finished, we've seen the numbers really improve over time, and we were very hopeful when we went to the Christmas holiday that when we came back we would continue to see that improvement. But what we saw was a surgence of the Omicron, the variant, which really changed our data and really kind of elevated the numbers that we were seeing, which really kind of encouraged all of us to go back to our safe school protocols in a much higher level. And I'm really happy to present that our data that last week and our data that came back actually this week has really showed a significant drop-off in those numbers of COVID contacts in our district, in our state, and our community.
So a couple of weeks ago, I know we were dealing with some staffing shortages. How are we doing now today?
We did have a number of staff who had to step out for a short period of time to contend if they were COVID positive or they were a close contact. And we did have some staffing shortages on transportation, in our cafeteria, in every one of our campuses, in our district. And we have some really phenomenal people who stepped up to make sure our students who were coming in person had a loving, caring adult in every one of our classrooms, to make sure our students who needed transportation, that we would be able to keep all of our bus routes. What we're seeing now as our numbers improve is those shortages in staffing that we were observing have kind of dissipated as well. And so we have more folks back, we have more folks in the classroom, and we're getting to a period now where we're seeing a more normalized school environment as opposed to just trying to band-aid everything.
That is such great news to hear. Thank you so much. Ms. Guerrero, let's go ahead and talk about testing. There has been some confusion over testing, symptomatic versus asymptomatic. Can you explain the two and who should get which test?
So symptomatic testing is done for individuals who are symptomatic, who are having symptoms, who are feeling sick, or even if you're just not sure if you're well enough to be at school or at work. That's when you should have symptomatic testing done. And that's done through our curative sites. That is being held at both stadiums, the Dragons and Titans Stadium, every day of the week, and it's from 8 to 6 p.m. daily. For asymptomatic testing, that's a little bit different. That is more, we've been doing that for a while on our campuses, and that's done weekly. It's voluntary, but that really should be done when someone is not sick at all. It's mainly for screening, and it is, more of a measure, a protective measure, so that we kind of know who might be contagious to someone else when they are not having symptoms.
So to be clear, if someone has symptoms, they shouldn't be going to the campus testing.
Yeah, definitely do not go on to campus if you are feeling sick or if you are having any kind of symptoms. That's when you want to schedule yourself at the curative sites.
Okay, well, the CDC recently made changes to the number of days to quarantine. Can you break that down for us, Ms. Guerrero?
Yes, so if you are positive, if you test positive, regardless of vaccination status, regardless of anything, you need to stay home 5 days. And then once you are hit that 5 days, or you pass that 5 days, if you are not having any fever for at least 24 hours, and if your symptoms are gone or at least resolving, you've improved, then you may return to work and school on the 6th day, but you need to continue to wear a mask for at least 5 days.
Okay, so let's talk about vaccinations and booster shots and why it's so important, why we're encouraging those types of shots right now.
So vaccinations and boosters are one of the biggest ways that we can help protect our students, our community, the staff, and it's being recommended by CDC for anyone ages 5 and older. The booster is also recommended for anyone ages 12 and up. We are trying to have a lot of opportunities for our community to have vaccines here on our campuses. We have 4 upcoming clinics that are going to be available, and we'll have more information on that on our websites.
Dr. Verstuyft, I want to go to you one more time. Earlier you mentioned our stance on encouraging the use of masks. Can you go over that a little bit and some other safety protocols that we have in place here at the district?
In our district, we used to have a temporary face mask requirement to attend school in Southwest ISD. And when our numbers improved, we were able to move away from that and go to a strongly encouraged. As our numbers started to elevate again, Omicron kind of came onto the scene. It was a surge. We had elevated numbers. I know there are some questions about should we go back to a mask mandate or should we continue with the strongly encouraged. When we looked at our data over time and look at it compared to other districts, and understanding that almost 90% of all of our students and our staff were adorning masks under the strongly encouraged, we did not feel that it was a need to go back and put in a requirement or a mandate because we have a phenomenal community, phenomenal families, students, employees, and staff who were already doing the mask mandate at a very high level. And so we didn't feel it was necessary to go back to a mandate when there are so many people who are voluntarily applying the safe school protocols, the layers of mitigation or prevention. In this case, the mask we think was a benefit and assisted Southwest in getting to this point now where we're seeing that our numbers are getting to a more very manageable position today.
That's wonderful. Is there anything else that either of y'all would like to add?
You know, I think I want to thank our communications department. I think it's important to continue communicating and sometimes just having a normal conversation about this and videotaping it and giving out to our family members. I think it's critical. I know we did not go back to a mask mandate, but what we did a few weeks ago is we went to an influence campaign and we talked about the importance of masking and we talked about the importance of frequent hand washing, the importance of using plexiglass within our campuses to make sure that we have multiple layers of safe protocols to keep our students safe, keep the adults safe in our system. We know that our students, they're all going to have futures, and we are still keeping the effective teaching and the effective learning as paramount in our district, along with keeping our youth and our adults safe. And we could not be at this position right now if it were not for our family members, if not for our community, our employees, our students. If they were not doing what they needed to do, we probably would not be at the rate that we are right now, where we're feeling more confident about the future, optimistic about the future. We just need to keep doing what we're doing and get through this, and our students need to keep learning, and our teachers keep teaching, and we will get through this together, no doubt.
Well, that's all of our time. We hope you found this update helpful. For more information and the latest COVID-19 updates, just head to our website, swisd.net. Have a great day, and remember, we are Southwest.